Welcome. My name is Dr. Chris Montanaro. I am a board-certified chiropractor and a specialist in applied kinesiology. I specialize in treating people with difficult-to-treat conditions. Today we're going to cover a section on carpal tunnel. My goal is to arm you with incredible information about your health and your body so that you can live a long, happy, and quality life. So what is active release technique? Active release is a patented soft tissue management process that is effective for the care of overuse, sprain strain symptoms like numbness, tingling, and weakness. ART is a movement-based soft tissue symptom that targets scar tissue to correct muscle function and free nerve entrapments. By releasing scar tissue and correcting movement and function, ART yields significant improvement and/or resolution prior to becoming severe or costly. Here is a short list of some of the many things that you can treat with ART. Carpal tunnel, repetitive strain injuries, nerve entrapments, tennis elbow, many rotator cuff syndromes, neck and shoulder pain, sciatic nerve entrapment, plantar fasciitis, hand weakness, numbness and tingling, and Achilles tendonitis. Here is the formula for the insult to the tissues. I stands for the actual insult or destruction to the tissues. N is the number of repetitions. F stands for force, so the tension of each repetition as a percent of the maximum muscle strength. A is the amplitude, and R is the relaxation time between repetition. Lack of pressure or tension on the tissue involved. And here's a couple examples that might help you understand this just a little bit better. Vibration, for example, results in an N, the number of repetitions that is high, an amplitude that is low, and a rest interval that is low. The result of an insult to the tissues is very high. Another example is posture that is poor and unchanging, results in constant high forces in the musculature. A force is high, amplitude is next to zero, and rest is essentially zero. Therefore, the tissue insult is very high. A person that is weak will use a higher percentage of their maximum strength to accomplish a given task. Therefore, the force is high and tissue insult is high. And the last example is a keyboard operator may experience 10,000 repetitions per day, a force of 2% of their maximum, an amplitude of 10%, and a relaxation time of 0 because the muscles never relax. And this is going to lead to a very strong high insult to the tissues, creating a lot of scar tissue and adhesions, leading to numbness, tingling, and weakness. Now here is a diagram for the cumulative injury cycle. Let's start off at number 1 with a tear or a crush injury. What will happen first is you'll create inflammation. It'll lead to adhesions and fibrosis as the healing process is taking place, which ultimately is creating weak, intense tissues. As that continues, you'll get more friction, pressure, and tension, and then the chronic cycle is going to begin, and you're going to get decreased circulation and edema from the scar tissue that's built up, which is here, and then it's just going to keep going around and around and around in a cumulative cycle and chronically become worse and worse. Dr. Leahy developed ART and had amazing results, reaching over 90% of all of his patients. He attracted the attention of many professional football players, was hired by 2 NBA teams to treat and consult, helping several players avoid permanent injury, national team swimmers, U.S. weightlifting team, and treating at the Ironman Triathlon in Hawaii. Something happened in 1990 that skyrocketed ART. A medical director of a large occupational clinic invited Dr. Leahy to speak at a doctor's staff meeting. He talked about carpal tunnel syndrome. Halfway through the meeting, he became aware of the magnitude of the problem and the frustration that these doctors had in relieving the pain. He couldn't believe it because he had so much success in resolving carpal tunnel syndrome in just a few visits. Seeing an opportunity, Dr. Leahy offered a challenge to these doctors. He said, "Send me your 5 worst carpal tunnel syndrome cases and let me see what I can do." The medical histories of the 5 worst cases revealed that they had been under treatment for at least 2 years, 3 had experienced at least 1 surgery, and all of them were adversely affected at work. The results, all 5 cases were resolved within 3 visits. They all returned to full-time, pain-free duties at work. That success caused a new surge of interest in ART. Today, ART is considered the standard of care for cumulative trauma disorders in Colorado Springs. ART is also a program that was recognized by OSHA as a best management practice for treating sprain-strain injuries as a preventative measure. Every ART session is actually a combination of examination and treatment. The ART provider uses his or her hands to evaluate the texture, tightness, and movement of muscles, fascia, tendons, ligaments, and nerves. Abnormal tissues are treated by combining precisely directed tension with very specific patient movements. There are well over 500 treatment protocols which are unique to ART. ART is not a cookie-cutter approach. Each course of therapy is individually designed to resolve the patient's problems. Whether you are an office worker, a weekend warrior, or a world-class athlete, the preventative and restorative benefits of ART can help you perform at your best. So who practices ART? ART is classified as a multidisciplinary procedure which is practiced by numerous practitioners from a wide range of medical professions and disciplines, including chiropractors, physiotherapists, massage therapists, applied kinesiologists, and sports physicians. ART is not massage though. Massage therapy is able to aid in rehabilitating physical injuries by acting directly upon the muscular, nervous, and circulatory systems. ART and massage therapy work extremely well together as adjunctive therapies, with each serving different functions. Massage therapy by itself does not effectively address issues related to scar tissue. ART is not physiotherapy. Physiotherapy includes procedures such as manual therapy, therapeutic exercises, and the application of electrophysical modalities. These are valuable procedures, but again, they do not address or resolve the underlying problems caused by the formation of scar tissue. Traditional chiropractic care focuses upon the relationship between the spinal skeletal system and the nervous system. It does not focus on the treatment of soft tissue. ART and chiropractic do work very well together, but without ART, the results of chiropractic techniques are often limited in their ability to provide complete resolution for many soft tissue conditions. Chiropractic works well to release joint capsule restrictions, but these restrictions will return if the original soft tissue problems are not addressed. ART is not surgery either. Surgery uses invasive techniques in an attempt to resolve soft tissue dysfunction. Surgery, though sometimes necessary, often results in numerous complications, adverse reactions to medications, and extended time away from work. In fact, surgery often results in the formation of more scar tissue. In my opinion, for most cases of repetitive strain injuries, surgery should be the last option to be considered. In results, I certainly can't promise that ART will do this for you, but 3 to 6 visits is a non-invasive way and less expensive option than any other option out there, and results are often very fast. You have nothing to lose by trying, and you may save yourself from an unneeded surgery. It happens in my office every single day. It's definitely worth a try. Thank you for listening. I would like to offer you a special gift to come into the office for a free history and consultation. I believe your health is too important, so I'm offering this gift at no charge. Please take advantage of it. Fill out the contact information on my website and call the office to come in for your free consultation. I hope you enjoyed this information and the other videos that are available. Thank you, and I will look forward to seeing you soon and being a part of your health team. And if you do not live in the Syracuse, New York area, you can still visit my website and find links to find a certified ART provider in your area. Thank you, and have a wonderful day.